For years now, Scotland's drug death crisis has been this just national tragedy. Well, the latest figures are out, and we're going to break down what they actually mean. All right, let's get into it.
So here's the number that's been all over the headlines, 1,017. But it's so important to remember that behind that number, each and every one of those digits represents a person, a life that was cut short by a drug overdose in Scotland just last year.
Now, on the surface, a 13% drop, that sounds like a huge win, right? And look, any fall is good news. But, and this is a really big but, we have to look at the context. This is still the lowest total only since 2017. So yeah, the arrow is pointing in a better direction, but the sheer scale of this crisis, it's still just massive.
And when you zoom out and put this into a wider context, honestly, it's pretty sobering. Even with that drop we just talked about, Scotland's drug death rate is still 2 to 3 times higher than the rest of the UK. And across all of Europe, it's still the highest recorded rate. That is the stark, undeniable reality of the situation.
Okay, so to really get a handle on what's going on here, we've got to look past that big top-line number. We need to actually deconstruct the data. What drugs are involved? Who is most at risk? Let's dig a little deeper. The first thing that jumps out from the data is just how complex these deaths really are. It's almost never a case of just one substance. I mean, look at this. Opioids, think heroin and methadone, they're involved in a staggering 80% of cases. But then you see the overlap. Benzodiazepines are a factor in 56% of deaths, cocaine in 47%. This polydrug use, as it's called, is a huge, huge part of the story.
And this timeline, wow. It really shows you just how dramatically this whole crisis exploded over the last couple of decades. If you go back to the year 2000, the rate was about 5.4 per 100,000 people. Then it just skyrockets, peaking in 2020 at an unbelievable 25.1. So today's rate of 19.1, yeah, it's an improvement, but it is still more than 3.5 times higher than what it was at the turn of the century. Just think about that.
Now this is an absolutely critical piece of the puzzle. The connection between poverty and drug deaths. It's not just a theory, it is a cold, hard statistical fact. Someone living in one of Scotland's most deprived areas is 12 times more likely to die from an overdose than someone in the wealthiest areas. 12 times. That tells you everything, doesn't it? This isn't just a health crisis. It's fundamentally a crisis of deep, deep-seated inequality.
And if we look at the geography of this crisis, there's a clear epicenter. While it's a problem for the whole country, no doubt, Glasgow City's death rate stands at 41.1 per 100,000 people. That's more than double the national average. Just staggering.
So faced with these horrific numbers, how did the government respond? Well, right when the crisis hit its peak, they launched what they called a national mission to save and improve lives. But what does that actually mean? What did it involve? Okay, so the mission had 4 main goals, right? First, and most obviously, get the number of deaths down. But it was also about improving access to residential rehab, cutting those long waiting times for treatment, and crucially, setting up consistent standards of care no matter where you are in the country. And they didn't just talk the talk, they put some serious money behind it. An extra £250 million, that's 250 million, was committed to addiction services to try and make this mission a reality. But, policies and funding, that's one thing. It's easy to talk about numbers and strategies. But at the absolute heart of this crisis are real people fighting for their lives. So what is that fight? What does recovery actually look and feel like on the ground? I want to tell you about Karen. She's 49, and she's been battling addiction to heroin, alcohol, and cocaine. She told the BBC that when she finally got to a rehab facility in Glasgow, she weighed just 4 stone. Her words are just so powerful. She said, "I kept saying, I can't do this, but I did it." That right there, it's just such a powerful reminder of the human stakes and the incredible strength it takes to recover. See, yeah, Karen's story is one of real hope, but the wider picture of treatment and recovery in Scotland, it's filled with all sorts of complexities and challenges. It's really not a simple, straightforward path at all. And that brings us to one of the most complicated parts of this whole thing, what some people call the methadone paradox. See, on the one hand, it's a vital tool for treatment. It's prescribed around 29,000 people to help them manage their opioid addiction. But on the other hand, for the 5th year in a row, it was involved in more fatal overdoses than heroin was. So it's this strange thing where it's both a lifesaver and a major contributor to the death toll.
And the challenges, they don't stop there. An official report from Audit Scotland actually described the mission's progress as mixed. The government is still short of its target for rehab beds. And get this, drug-related hospital stays actually grew by 15% last year, all while the demand for these life-saving services is still incredibly high.
But it's so important we highlight the major successes too, because there have been some. Over 130,000 overdose reversal kits, these contain the drug naloxone, have been handed out since the mission began. These kits literally save lives on the spot, and their rollout has been a really significant achievement.
So, where does that leave us? We've got this mixed progress and a landscape that's constantly shifting. Naturally, the conversation is now turning to the future. What new dangers are on the horizon, and what's the political debate around the best way to move forward?
Okay, so this is the next big threat. You've probably heard of fentanyl. Well, now health officials are sounding the alarm about something called nitazenes. These are unbelievably powerful synthetic opioids, sometimes more than 100 times stronger than heroin. And what makes them so terrifyingly dangerous is that they're being mixed into other drugs. People are often taking them without having any idea they're even there. Just last year, they were linked to 76 deaths.
From the government's side, the drugs minister, Mari Todd, has basically said they'll continue to do everything we can. The official line is that they recognize the progress made, but are now bracing for this new threat from synthetic opioids.
Then you have the opposition. Scottish Labour's Jackie Baillie says that while, of course, any reduction is welcome, Scotland's drug emergency is still claiming far too many lives. Her point is that much more has to be done to support people in their recovery.
And the Scottish Conservatives are even more critical. Through Annie Wells, they're arguing that SNP ministers have repeatedly taken their eye off the ball and that they still don't have a coherent and credible strategy to deal with this.
And all of that really brings us to the final crucial question, doesn't it? We've seen some progress, but it's been slow and it's been hard-won. Now, with these deadly new synthetic drugs like nitazenes starting to flood the streets, can the current mission really adapt fast enough to stop those numbers from climbing all over again?